Dr. Patino here at the Cosmetic Surgical Center of Cerrito. So we are doing an extended tummy tuck on this lady. So she lost a lot of weight, and now she has all this excess skin and fat. We're still going to do a very, very extended tummy tuck. We're gonna go to the back side, but no bleeding. Thank you. Okay, so notice the complete absence of bleeding, huh, Nicholas?
Yeah.
This is incredible, huh? So we see these pretty much on a daily basis here at the Cosmetic Surgical Center of Cerrito. Being in a patient like these that, you know, they usually have big arteries and veins. Look at this. This is pretty much unheard of. So we waited a long time. It's a combination of things, right? We stopped the vitamins, all those things. So you can see bloodless surgery every day. Thank you. So what is the name of this fascia that we're going through here?
Carpus fascia.
Carpus fascia. Very good. And carpus fascia divides
Superficial fat from deep fat.
superficial fat from deep fat. Very good, Emily. That's how we do it here. That's a big blood vessel there. And look how slow we go. You know, we just take our time and do a very completely bloodless dissection here at the Cosmetic Surgical Center of Cerrito. We're gonna clamp that vessel a little later. Thank you. The blood vessel that we're talking about, and it is basically, can you see, Nicholas?
Yeah.
Close up on that. And I'm angling a little bit. You see that? It even has a noise to it, right? Incredible. Look at that. And that's the vessel is divided. It's basically no. You can even see fire, right? No bleeding at all. Thank you. Very well developed fascia that you can even see. I don't know if you can see there, Nicholas. That's the anterior portion of the carpus fascia, posterior layer, and they join in the middle later. And this is deep fat, of course, and this is the rectus abdominal fascia. Looks great. Thank you. So you see that blood vessel right there, Nicholas?
Yep.
Yeah, that's a big one. And so, like I said, she's gonna have big blood vessels here, but notice the complete absence of bleeding. There is absolutely no bleeding here at the Cosmetic Surgical Center of Cerrito. Notice the white part in the middle. It's gonna get white. See, it's kind of bluish, and now, as I'm seeing how it got white. You see that? See how it got white? There we go. Very nice. And then now we're gonna burn it, and no bleeding. You see that? Incredible. See? Not a drop of blood, huh? It's just very nice, huh?
Amazing.
Thank you. Okay, so the belly button is right there. We're gonna go in the midline here, and this is the specimen. So this is the part that we are going to divide, right, Emily?
Right.
Do you see any bleeding here, Emily?
No
Look at that.
bleeding.
Incredible, huh? Totally dry, man. This is just a beautiful surgery. There's a little blood vessel here. I don't know if you see it, but I just electrocoagulated it right away, and there is absolutely no bleeding. This is just incredible, right?
Yeah.
I don't know if you can see, there's a blood vessel right there. And so, let me show you inside, okay? Here. See, there is no bleeding at all. Let's do Instagram here too. Alright, so there's some blood vessels here, but notice the complete absence of bleeding, huh? It's incredible. There's a little blood vessel here. So what I do is I electrocoagulate it before I go into that area, right? And so that's how you do it. No bleeding at all here at the Cosmetic Surgical Center of Cerrito. Look at that. Look at that. Incredible, huh?
Yeah.
We're just cutting before your very eyes, and you can see how there is absolutely no bleeding here, huh? Look at that. Incredible, huh? Man, I love doing these, you know? And look at that. This lady, we can say she went to see 7 surgeons before she came to me. You just told me that. I didn't know that.
Yeah.
Yeah, and I want to show you. She felt very confident when she came to us. But I'm going to show you this blood vessel right there, Nicholas. You see that blood vessel, Nicholas?
Yeah.
Yeah, that's something. I mean, that's something that you may want to electrocoagulate. But you see how it turns white? You see that?
Yeah.
It's incredible, huh? And that's just doing a demonstration for you guys. But that's how you see these blood vessels, and then you go through it. you know, but if you go very fast, then they're gonna bleed, right? So you gotta set this instrument in the right settings. It's called an electrocoagulator, and just go slowly, right? And this is nothing fancy, you know. This is it's a little fancy instrument, but every surgeon has a version of it, right? And but it's not so much the instrument, but it is a combination of things, you know, from the pre-operative instructions, asking the patient not to take aspirin, ibuprofen, herbs, vitamins, things like that. But also the most important thing for us in anesthesia that we use, and the operative technique, you know how we take our time and go slowly, right? So we're gonna go around the belly button. She has a beautiful belly button actually. So we're gonna go around the belly button, and like we usually do, we don't amputate. In other words, we don't divide the belly button. We just go around it, and then later on, I'm going to show you how we do the umbilicoplasty. In other words, how we leave this belly button attached to the fascia, right? A little blood vessel there, but we don't cut it off, because the belly button has like a stalk, right? That has it's like a mushroom, like a little bonsai tree, right, Gabby? Right, Emily?
Yes.
I'm thinking about Gabby. Anyway, so Gabby called us last night, and anyway, she's doing very well. Right now, we're basically isolating the belly button, so we're gonna go all the way down, and we're gonna show you what is called the umbilical stalk. Is basically how it attaches to this is the fascia, right? And she does have a significant amount of excess fat that, thanks to God, we're gonna remove, right? She's very excited about this procedure, and this is the fascia. Look how white and beautiful it is. Look at that, gorgeous, no bleeding at all. Thank you. Wow, so this is an extended tummy tuck, and I go, as usual, all the way up to the end of the chest bone here. Let's go the xiphoid process, and I'm actually over the ribs. See, all these I detach, right? And here too, when you do a lipoabdominoplasty, it's a different technique. You just make a tunnel here, and that's it. Everything's still attached on either side, but this is, let me show you. Do you see any bleeding there, you guys?
No, no bleeding.
Incredible, look at that. No bleeding at all. And let me show you this artery right there. Can you see that artery right there?
Yes.
That's a deep perforator of the superior epigastric artery. And this is a major vessel that provides blood supply to what she's gonna stay with. So we're gonna keep it. We kept it on both sides, so she looks good. Thank you. Okay, so this is a major extended tummy tuck. Look at that. I'm gonna be very generous and try and get as much as we can, man. We're gonna go all the way to the back here. Look at that. Thank you. Okay, so look at this, Nicholas. And we're gonna go, incredible, huh? Yeah. She's gonna be very happy, man. That all this stuff is like liberating, huh? You're gonna basically take all this out. And do you see any bleeding here, Nicholas?
No, zero bleeding.
Incredible, huh? You excited?
I'm excited.
Man, thank you.
Action.
Okay, wow, look at that, huh? You see that?
Yeah.
I'm gonna show you something. There's a little blood vessel there. You see it right there? So what I do is I'm gonna knock it down, you know, see? Before I even divide it, see? I knock it down, burn it, and then I go to it, see? And absolutely no bleeding. That's how we do it, but you gotta watch them, you know, because sometimes they sneak up on you. No bleeding, thank you.
Action.
Whoa, man, this is a big piece. Wow, man, I don't know how much this is gonna weigh. We're gonna weigh it. Look at that. Put this over there. Wow, this is literally half of my body. Look at that. Incredible, huh? Look at that. Incredible. Thank you. Oh, so what are we doing now, Emily?
Making the new home for the belly button.
Awesome. Thank you. Okay, so now what I'm gonna do is I'm gonna make a hole here for the belly button to come out of. This is the new home of the belly button. I come out, and Nicholas goes in and makes that hole, right? Thank you. Okay, so when I lift here, I can see the separation between the rectus abdominal muscles, and this is her belly button right there. So we are going to restore her anatomy and put the muscles together. Thank you. She does have some intra-abdominal fat there, and we already did the top part, right, Nicholas?
Right.
And now we're gonna do this part right here. So I'm gonna show you at the end of the day how she's gonna be. So at the end of the day, she's gonna be flat like that. Thank you. So this is her belly button, and this is the rectus plication above and below the belly button. Look how tight she is now. She doesn't have that bulge anymore. Thank you. Okay, so we're getting ready to put the drain, and notice how I make an incision. There is absolutely no bleeding, and I put the clamp through the incision, and Nicholas shows me the drain, and that's all there is. Thank you. Wow, so this is almost a torsoplasty. Up to here would be a torsoplasty, so we went almost all the way to the buttock crease right here. The buttocks are right here. So this is an extended tummy tuck. Look at the nice waist, you know.
Wow.
She had a big, how do you call it?
A roll.
Roll here. You can even see the crease there, and it's gone. Looks very nice. Thank you. Okay, so this is almost a torsoplasty. Here's where the intergluteal crease is. These are her buttocks right here. Look at the fact that she had a roll here, and she still has that skin crease, but you know, everything is tight, you know. She has a nice waist. She looks good, so almost a torsoplasty. Look how much more we do on either side. Thank you.